In this video, we'll discuss the most common types of urinary incontinence. First, you should learn what urinary incontinence is. Urinary incontinence, UI, is characterized as the disorder of compulsory spillage of urine. Urinary incontinence is the point at which an individual can't keep pee from spilling out. It is often joined by other irksome, bothersome lower urinary tract symptoms, such as urgency, increased daytime frequency, and nocturia. Types of urinary incontinence. So, there are 6 main types of urinary incontinence: acute incontinence, persistent, urinary incontinence, bladder, overactivity, mixed, urinary incontinence, overflow, incontinence, functional, incontinence. Here, we'll discuss each type of urinary incontinence in detail. Acute incontinence. Urinary incontinence that is of relatively recent onset or associated with an acute medical problem should prompt a review for reversible factors. These include the following: cystitis, atrophic vaginitis, and urethritis, heart failure, polyuria from diabetes, delirium and acute confusional states, immobility medication side effects. The common type of acute incontinence is discussed below: drug-induced urinary incontinence. Several medications are associated with acute onset urinary incontinence, including diuretics, adrenergic agonists, e.g., pseudoephedrine, adrenergic antagonists, e.g., terazosin, anticholinergics, and neuroleptics. Persistent urinary incontinence, urethral, underactivity, stress urinary incontinence. A few patients distinctively experience urinary incontinence during exertional activities like exercise, running, lifting, hacking, giggling, and sniffling. This suggests that the compromised urethral sphincter is presently not ready to oppose the progression of pee from the bladder during times of active work. Increments in intrastomach pressure during active work are sent to the bladder, an intrastomach organ, compacting it and constraining pee through the debilitated sphincter. Bladder overactivity, urge urinary incontinence. Bladder overactivity, including bladder filling and urinary storage, portrayed by compulsory bladder withdrawals, is named urge urinary incontinence, UUI. Clinical indications of bladder overactivity happen because the detrusor muscle is overactive and contracts improperly during the filling stage. The symptoms of overactive bladder are normally urinary recurrence, desperation, and urge incontinence. Recurrence is characterized as exhausting the bladder more regularly than 8 times each day. Desperation is portrayed as an unexpected, powerful urge to pee. Individuals experiencing bladder overactivity commonly need to purge their bladders often, and when they experience an impression of earnestness, they might spill pee in case they can't arrive at the latrine rapidly, or on the other hand, if the vibe of criticalness is exceptionally strong. Mixed urinary incontinence. Different kinds of UI might coincide in a similar patient. The blend of bladder overactivity and urethral underactivity is named mixed incontinence. This is regularly a troublesome finding to make as a result of the frequently confounding exhibit of introducing indications. Bladder overactivity may likewise coincide with weakened bladder contractility. This is generally normal in the old and is named detrusor hyperactivity with weakened contractility. Overflow incontinence. Overflow incontinence happens when the heaviness of pee in an extended bladder conquers outlet opposition. Spillage of limited quantities of pee is normal for the day and night. The patient might grumble of reluctance, reduced and intruded on flow, a need to strain to void, and a feeling of incomplete emptying. Functional incontinence. Functional incontinence happens when an individual can't or is reluctant to arrive at the toilet to pee. Normal causes are musculoskeletal problems, muscle shortcomings that impeded mental status, utilization of actual limitations, mental disability, ecological boundaries, and meds, e.g., tranquilizers, neuroleptics. I hope you enjoy the video and learn from it. If you want me to make more informative videos, please subscribe to my YouTube channel as a token of motivation.